Before we head into our community, I'd like to paint this picture. Imagine a community that has no adequate health care access. What will it look like? What would pregnant women do? What would children do? And, you know, imagine there's an emergency in the middle of the night. What's going to happen? Well, that's so many questions that's running in my head right now, because we're heading to Bandiyili. And the residents of Bandiyili are actually appealing for a CHPS compound to improve health care. Just a CHPS compound. They're not even asking for a full-blown hospital. A CHPS compound just to improve health care. Anyway, we actually have a report from our correspondent, Mohammed Aminu Alabira, and he's actually in the community right now. So he's going to take us through this after we watch this report. And when we come back, we'll be talking to him.
Bandiyili and its surrounding communities in the Nanumba South District continue to face serious difficulties, particularly in accessing healthcare services. Residents are often forced to travel to either Kuko or Bimbila for medical attention. However, the roads linking these communities are in a deplorable state, sometimes leading to delays and even fatalities. ChannelOne encountered a medical outreach team attending to residents under a tree in the community. In an interaction with ChannelOne, some women shared their challenges they face and made a passionate appeal to the government to consider providing them with a CHPS compound.
Anajo akola yari kwampa asam ede mai wa hana nti problem aye ha hono no yesram some be boy ahaban de hanya hankwa na village na twitwa mu twitwa hia wa hana village na ebi kika ho nya hankwa mu nyina ha mo ba but still nka mu nya chief compound with mai wa hana the be yende
taka aship de yango de me kalati de lanka kwam the power zero wa alapa na malpule bambala kan za anda za ai negi yayi na mutashin cewa nyami su jan bambala mutazza am so ku ko sol ma ba fiara dan to can ku mutazza am bi zan a can ba ka kuna akala fi da ma sol ma ba fiara ba ama yaya.
Community members have taken the initiative to renovate an old teachers' bungalow to serve as a community-based CHPS compound. Other community members also joined in the appeal for support. A health worker on the outreach exercise also highlighted the challenges they encounter whenever they visit the area.
So far there is no facility. The only thing that we can do is to just work under trees.
Okay. And
the problem is that because the facility is not provided and we working under the trees, looking at the weather condition here, it's not favorable for us to be working under the trees. While the place will be open and the wind will be blowing, destroying our blessings and a whole lot of things.
So they are
pleading on the behalf of the government and any other NGOs, if they can come and sit in and help the community to get electricity and even also help them to renovate their facility for them, and also come and also provide maybe water for the facility to also get good drinking distance.
So moving over, we are still continuing with our, community development story. We actually saw a report from Bandiyili where residents are asking for a CHPS compound. We heard the women speak, and ironically, we're still going to be talking to Mohammed Aminu Alabira, because he's a Northern Regional correspondent, and he's the one that put up this story. I don't know if he's on the line right now for us to talk about this, but it's quite unfortunate what's going on there. And I just have so many questions to ask when it comes to these issues, especially we keep on seeing the women giving birth and giving birth, but they have to travel travel long distances just for basic health care, and it is worrying because I keep imagining if anything happens at night, what is this person going to do? Or how emergencies can just happen from anywhere, especially with women that just had kids, you know. Anything happens, like a lot of things happen when it comes to having babies. They can just develop fevers at night. I want to probably see a doctor. What am I going to do? Anyway, we have Mohammed Aminu Alabira on the line, and who's our Northern Regional Correspondent. He brought us the story. Hi, Mohammed.
Yeah, hi.
How are you?
Yeah, I'm doing well, please.
All right, so from one story to another. So let's talk about the, Bandiyili issue. Can you give us a picture of what this whole issue is about, especially when it comes to getting basic health care? How long they even need to travel right now to get to the nearest hospital?
Thank you very much. Yeah, healthcare delivery in Bandiyili and surrounding communities is seriously a challenge to the people over there. This is because the community is a rural community, farming community in the Nanumba South district, and the nearest place that the people can access healthcare is either Bimbila, which is Nanumba North Municipal Capital, or to Kuko. Kuko is the witches camp in the Nanumba South district here. So, and the roads leading to the place are in a terrible state.
Right. So apart from
motorbikes and cars, the common means of transport in that area is motorbike or these tricycles. Even the aboboyas are not there. It's just the tricycle, the one they use to carry things. That's the only thing that when a pregnant woman is in labor, they will have to put her inside and then carry her through the bad road. That is the state of condition there.
And then these hospitals that they go to, are they full-blown hospitals or they are just CHPS compound too?
Yes, what happened was that because of the challenges the residents there go through, there was this an old teacher's bungalow that was living in the community. So through the community initiative, the community, they have come together, contributed money to renovate the bungalow. They have re-roofed it, painted it, and even the floor, they've done everything. What they are asking now is that the Ministry of Health or the Nanumba Staff District Assembly should help them post nurses to the community, so that will help reduce the suffering or the suffering of the women in the community. One thing is interesting in this part of northern region. Men accompanying their wives to the hospital is something that doesn't usually happen, especially in the rural communities.
Why?
If a child is sick or the woman is sick, it is the woman who will find out what to do. It's just one man that you will see, maybe doing those things for the wife. But for the rural communities, it's something. Everything, when a child is sick, it is left to the responsibility of the woman. So women are actually suffering here.
Yeah, clearly the women are suffering there. But I want to ask you a question. Now that you've said that it's a community that leaves women to themselves when they have to go to the hospital or even take their children to the hospital. When you look at the family dynamics, how many children do you think one family has?
A family, the least children a family can have is, say, maybe even five is even less. 5 is even less. The rural communities, but you will see one family and you think that it's a football, it's a football club.
Wow. And
yes.
And that burden is on the woman.
All the burden is just on the woman. Some families here, my boss, some of the men, their duty is just to provide. Say here yam is common. They'll just come and put the yam there. As to what the woman will do for it to turn to food, it is left to her. So seriously, some of the communities, the women are seriously facing challenges there.
All right, so
Bandiyili and surrounding communities are
right.
not accepted.
So back to healthcare. Do the men actually go to the hospital?
Yeah, the men go to the hospital only if maybe they themselves are sick, or the situation becomes so critical that no, some of them will just have to assist. Just that maybe a mother is taking a baby to the hospital, like these antenatals that they do, and no, some men will not accompany their women to the hospital.
Right. Okay. So, what kind of health issues do they deal with in that area?
Yeah,
Apart from childbirths and maybe antenatal issues.
Yeah, most or the common health issues over there has to do with maybe snake bites, because they are farmers.
Mm-hmm.
When someone goes to the farm and suddenly he's bitten by a snake or something, but assessing healthcare becomes a challenge. The person ends up losing their lives.
Right, right. Okay,
Yeah.
thank you so much, Mohammed. Thank you for the picture painted. We actually have the assemblyman of Bandiyili on the line right now. His name is Mboti Simon Ujakbo. Let's have this conversation with him. Hello, Mr. Mboti.
Hello, madam. Good morning.
Good morning. You're welcome to the show.
Thank you.
All right, so I understand your place does not have any healthcare center, and the residents are actually appealing for a CHPS compound. How true is this?
Yes, please. It is true.
And for how long has this been for?
Actually, it has been since 2017. We have been requesting for the CHPS compound. Up to date, we haven't gotten one.
Right, and okay.
And it is challenging to us.
Okay.
As I'm speaking with you, I'm currently in Bimbala Hospital with my wife, because last month it happened with this year in Bimbala Municipal Hospital. So from pregnant, we have to travel about 4 miles before we can get access to healthcare. And most of our people there, because of there is a village, some cannot even afford buying of petrol or how to get the means to there. And when it happened there, the challenging normally put on me as an assembly person, help them to get to the healthcare. This is also far away, especially when there is a labor case in the night. You can't do it for, labor, it can't consult you. You can start at any time.
Right.
Last month ago, we're moving one from the village, it happened the woman delivered on the way, which we cannot manage the person.
Right.
So we are appealing to His Excellency John Dramani Mahama to do something for us.
Right. Okay, so you say you're in the hospital right now with your wife. How long did it take you to get to the hospital, and what was your means of transport?
Actually, I use a motorbike, which takes me 1 hour.
1 hour?
Yes, please. I have to, even the child is in the house. As I'm speaking, when I clean, there was a key. So I have to wait till I get the dressing before I can go back.
Wow, that's rather unfortunate.
It's my brother. So if it's happening like that, I could remember last 2 months ago, a lady lost a child like that. Before we can get to the hospital, according to the midwife, he said the child was tied. And when they did a fear, the child will not survive. Because the means there hadn't been a motorbike unless it's motokia. How can a motokia transport a pregnant woman to a hospital? So it's
Interesting. In all of this, right, we know that there are district health services, right? So the Ghana Health Services has district office across the country. What's been their response to you? And even the member of parliament, are they aware of the situation? And as an assembly, what's been their official response to your concerns?
Yes, when that was, we are the current assembly elect. So when I've been elected, what I did was that I organize my people to contribute something so that we can put up a structure so that they make it as a sick base there, which can help my people of moving us and especially A and C. So we did so by referring about 4 rooms. So I wrote to the health director to help me to get at least 2 nurses there, so that when there is something happen like that, they can manage the person to be stable, so that we can move the person to the next stage.
Right.
So as I'm speaking, they also promised for giving me 2 nurses. So I'm doing follow up. So during the Christmas time, I did follow up. So they told me after Christmas, they will make sure that they will get us some. Because most of the people there, some don't even have faith. It happens some women deliver, they don't even attend hospital at all.
Right. Okay, so
I'm also putting in place for the get.
All right. So when did you write to the Ghana Health Service, and also why has it taken so long for them to send you a nurse or 2 nurses? Obviously, you're doing your parts, but why is it taking so long for them to actually, deliver their words?
Yes, I met a director. He told me the issue is the unemployment in the country. There are shortages of nurses. So some of the chief companies, they are into there. So it's difficult for them to remove one, leaving one. It happened that one of them is sick and he's one alone. It means that the person cannot manage the place. So they are also requesting nurses from the region so that when they are available, they can give me.
But if they give you a nurse right now, is the makeshift building, is it ready to accommodate them?
Yes, please. Accommodation is actually available. As I'm speaking, if it's today, even if it is that means to leave my house and give it to them, I'm ready. Because their health is most important than any other thing.
All right. So does your MP know about this?
Actually, I wrote to him that personally, I wanted to meet him in person so that I can also to find out whether my letters have been reaching him.
Interesting. Wow.
Anyway,
we've also been joined by the DC for the area. Good morning, sir. Very, very serious concerns are being raised by a reporter who began this by telling us the issues on the ground, and of course, the assemblyman for the area, Simon. What can you tell us about the state of healthcare delivery in Bandiyili, right? It's unfortunate.
Okay.
He dropped the line.
Yeah, so we just lost him.
We'll try and reach him out again. Because when I see communities, for example, that don't have electricity in 2026, right? I'm so much like shocked to the core.
Yeah.
Right. And to think that beyond electricity, they don't have there are actually communities that don't have a decent place for healthcare delivery, in 2026. It's very shocking. And I've heard the government communications minister, Felix Ofosu-Kwakye, say on record that government was committed to expanding the CHPS compound, nationwide. So we'll be hoping that that promise is realized, right? And I think that Bandiyili should be a priority area when it comes to the construction of new CHPS compounds, at the very least. Whereas while a long-term, plan in terms of providing a proper health care facility is thought through.
Yeah, I think the area really needs a lot of education apart from the CHPS compound. The fact that even the men do not take their wives to the hospital is a problem. The fact that these men actually leave them alone to just, take care of their own lives, especially with the children. But anyway, before I continue, we have the DCE of Nanumba South District, Mr. Abdul Rashid Musa, on the line right now. Hi, Mr. Musa. Hi, how are you? Welcome to the show.
I'm doing very well. Thank you so much.
All right.
And good morning to you, your viewers and listeners.
All right. Thank you so much. So let's get straight into the conversation. Mr. Musa, what are your thoughts about, what the residents are going through with this issue of lack of health care?
Yeah. Yes, actually that is actual or the reality on the ground. So I say kudos to your team and then your reporter, especially my brother, Alabila. Bandiyili is one of the communities in the district. And actually, let me just give you a brief overview of the district. I have about 132 communities. And then in terms of electoral area coverage, 28 electoral areas. And Bandiyili is one of the electoral areas. And 5 out of these 28 electoral areas do not have health infrastructure or a health facility. So it means they will have to rely on the next or their neighbor electoral area. And Bandiyili is not left out. So Bandiyili is actually having their access to healthcare from Kuku electoral area, which is their next neighbor. And then apart from that, the next possible place for them would be Bimbila. That is the municipal capital of Nanumba North. And they are not under my jurisdiction. So when I assume office, in terms of the overview, we have about 27 chief compounds that are serving the good people of the district. And you can imagine, it means in terms of health infrastructure, it is relatively inadequate. So Bandiyili is well on the table. Hopefully, or thankfully to His Excellency, the President of the Republic, John Dramani Mahama, his presidential directives and commitment to health service delivery, we are on course. 2025 was a very good year for us as Nanumba staff residents, and we are grateful to His Excellency. Because in terms of health, we're able to put up 2 brand new chief compounds, one in Nabayili, then the second one in Kanjokura, to take care of these residents. Then there was a store project and the legacy project that was left abandoned for years, because the last time the contractor was on site was in 2016. As soon as there was change of government, the contractor was nowhere to be found, or because the government then was not interested in continuing that project. So right away when we came back, and the legacy, we've been able to work on that, and currently is put to use. That is the Gunguni Garpe electoral area. There's a chief compound that we have been able to complete. Then the second one is Pudia electoral area, the Pudia Health Center, and currently there is a medical assistant and a team of health service workers who have been sent there. So Bandiyili is on the list. Unfortunately, it is not part of this year set of chief compound that we are yet to construct, because per the presidential directives, we are to put up at least 2 in a year. So last year was for Kanjokura and Nabayili. This year will be for 2 different sets of communities. Very hopefully, next year, 2027, inshallah, Bandiyili will be part, and then there's another community that will be part. But in the meantime, because of my mobility, I've been to that area, and the whole electoral area through that community did not have light, and then health facility is not there. So the community themselves, under the community self-help initiative, they came to me. I said, no, this is how they suffer in terms of their health. I was there with the chief police at the assemblyman place. Then we realized that no, the distance to the current place where they access quality health care is quite long. And then I heard your reporter mentioning about the fact that the men were not being supportive, and that's the reality, especially when it comes to farming season. Instead of them assisting our sisters or our mothers who are the vulnerable, and the children. They are the vulnerable in the society, but they prefer to go and see where they can get the daily bread. That's the farming aspect.
Wow.
So Bandiyili currently, in consultation with the community opinion leaders, assemblymen, and then the health directorate, there's a structure that we've identified. It's a transit quarters for the teachers. There's a Bandiyili primary school that the community themselves came to me that they wanted to start their own self-initiative. And of course, I've given indication that I am going to support any community that is willing to support itself in terms of some of these services. The assembly will support them just to make sure that at least we'll see if we can get some temporary structures. So Bandiyili, I've instructed the education directorate. We've written to them for them to release the facility for the community to use it as a temporary structure for health services. And they've done that. The community themselves have been able to mobilize something small to work on the structure. So we are in the process of posting at least a minimum of 3 health personnel there. At least 1 enrolled nurse, community health nurse, and then if possible a midwife for them to start or for them to manage that facility for us.
Right.
And the statistics that I was trying to give you concerning the 27 chief compounds, about 13 of them are makeshift structures. That is community structures. That's some temporary structures. It's only 14 of them that are permanent or well designed, well built from the assembly's coffers. Yes.
Right. Okay. So I like the fact that you want to support Bandiyili, especially for the fact that they have come out to say that, okay, we have this structure, we just need some nurses. And you've said that you are also, looking at helping them with that. But I would want you to tell us, like, is there any timeline to this? When do you think these nurses will be available to these people? Because obviously, when it comes to building a CHPS compound, like you said, they are going to be experiencing that in 2027. And 2027 is far. Labor doesn't wait till 2027. Making babies does not wait then. Malaria, polio, everything does not wait. So when are you going to be, giving them these nurses? When are you pushing for these nurses to be available to these people?
Yes, because of the numbers, because of the numbers in terms of the health service staff currently available. That is why I say we are pushing for at least 3 officers to be sent there. So now the structure has been worked on by the community. I've spoken with the traditional authorities, especially the region of Woolensey, who just returned from Accra yesterday. He has given me indication that he has spoken to a front office out there who is willing to see how they can support us with some equipment, some health equipment. I'm sure that is what is now holding. At least if you can get at least some 2 beds for a start, even if we get 1 deliverable bed for the midwife use, we can see how we'll do some adjustment, because for now the staff strength that we have is not enough, but we have to do some adjustment.
All right.
So with this meeting, I'm hoping that we are preparing to have our health committee meeting. The health director will furnish me with the latest update in regards to the adjustment of the staff.
All right.
See how we can move some of them there.
All right.
Okay. Thank you so much, Mr. Abdul Rashid Musa, who's the DCE for Nanumba South District. Thank you so much.
I'm grateful.
Amazing.
Thank you so much. Okay.
This was a very important conversation we had, and one thing I took from it that I think every woman should take from it: if the man is not helping you, close your legs, stop making more babies. They could have had more nurses, but they're making more babies.
No.
The
issues are more.
No, the issues are more than that. But for the basics, help your wife.
Yeah.
Help your wives get to the nearest place. These women are doing a lot, and I asked how many kids per family. Sometimes they're more than 5.
The issues are more systemic than you are placing the reason why there's poor healthcare is not because men are not taking care of their wives.
No, that's not the. We have spoken about the poor healthcare, but it's another problem when there is poor healthcare and these women are trying to get to these hospitals far away, 1 hour away from them, and nobody wants to help them. The man that made the baby with them cannot help you to go to the hospital. He's giving you yam.
It's a fair point to say.
He's giving you yam.
It's a fair point to say. Husbands should help their wives.
We really need family planning in these places. We need serious family planning in these places.
Anyway, that's all time will allow us for our conversation on Bandiyili. We just want to urge the authorities to do what they have to do in terms of providing the necessary healthcare delivery needed for the area.